Story on India tonight. It's on the healthcare sector. The union budget for 23-24 is scheduled to be presented in Parliament by the Finance Minister Nirmala Sitharaman. Market watchers closely tracking all developments on this, and our focus is on the healthcare industry. And that industry is even more impatient because many analysts believe that the government should enhance budgetary support for that sector. Today, we look at some of the expectations that the healthcare sector has from the government and some ways that affordable healthcare can be made that much more inclusive for all sections of society. But before we get in perspectives, here's a word coming in from Preetha Reddy of Apollo Hospitals talking about India's healthcare and how the country needs to increase insurance penetration to make healthcare that much more affordable. Here's what we got from Preetha Reddy.
Healthcare in India, whatever we do, we're still doing it at 1/10 the cost. We're importing equipment, consumables. It's only the manpower and infrastructure costs. So there is a cost to input and there's a cost to quality. But that does not say that, we can get away from it. And one of the biggest answers to that problem is insurance, and I think a lot of states have their own state insurance, which is doing very well. PMJ is picking up momentum, and I think that's a phenomenal move. And a lot of healthcare private insurers, even in the Western economies, it is the insurer who's paying for healthcare. It's very expensive, but people are insured. So I think it's a culture shift and makes it more accessible to people. So I think that is definitely one answer. The other is that however much we build, healthcare infrastructure, it's not going to be enough unless we take care of the problem of the non-communicable diseases. COVID taught us a huge lesson. Yeah. But we must remember that whether it's cancer, diabetes, heart issues, it's still a big problem. So within our organization, we have said that the whole focus is to keep people out of hospitals.
Should the focus be to keep people out of hospitals, or do we need to create infrastructure that is all-encompassing, a universal healthcare system? Well, my colleague Anurag had a chance to go on the ground, and he had a chance to speak with several senior citizens. And these senior citizens were out for their morning walk in a park in Kandivli in the suburb of Mumbai. And Anurag asked them what their expectations are from the budget this time around, what the problems that they face are when it comes to accessing healthcare in India and when it comes to insurance as well. What are the issues that they see in paying high premium when it comes to insurance? Here's what we got from them.
I wanted to understand from you, from senior citizen point of view, what should be done in upcoming union budget regarding insurance or healthcare?
I think it increase the limit and subsidy direct to in medicine for senior citizen, and all private and government hospital is like limit provided for free medical checkups and medicines given to senior citizen.
So we have people who are already having certain baseline medical conditions like blood sugar problems or blood pressure problems, and so I feel the insurance people must take this into consideration and not put that as a deterrent to provide health insurance. These should already be considered, and then they should provide the insurance accordingly, considering these basic health line problems.
There is a scheme of government which is called Ayushman Bharat, and in that Ayushman Bharat they cover around 50 crore people of below poverty line. So senior citizen can be considered in Ayushman Bharat scheme because for them it's difficult to get outside coverage.
Yes, something should be done because so many insurance agencies are there. But now at the stage, my husband has crossed 69, I have crossed 64, nearly 65. Now to start with a new some policy and such a big amount of premium is very difficult for a pensioner. So for middle class pensioner, senior citizen, there should be some policy where premium should be less and proper informative form should be filled up.
Retired people should be covered under the, or senior citizen or people above the age of 65 can be covered under the government Ayushman Bharat scheme, which gives insurance coverage of 5 lakh rupees.
That is a great opportunity. That is a great idea. And senior citizen will be able to, will be more comfortable with that.
Okay.
That is correct. But whatever is existing policy I am having, with that policy I want to continue also. So it has become difficult to do the payment. Right?
Your premium has increased.
Premium is increased. And my income is going down.
So
how will I
inflation
manage?
is there. So there should be something for senior citizen to come under the gambit of insurance, like a government sponsored scheme or something like that.
Yeah. That
is-
has to be. This is the most important point one should consider.
Well, that really sets the tone for this discussion that we are about to have. Dr. Chandrakant Laharia is consulting physician and he's joining us on the show along with Dr. Vivek Talaulikar. He's the CEO at Global Hospital in Mumbai. Great to have you both, doctors. Dr. Talaulikar, coming to you first on the COVID front. With these new variants, these sub-variants that are getting detected, do tell us what are the COVID-related budget outlays that you think the Finance Minister must include this time around? How strong is the case now for universal health coverage? Or should we just keep the focus on keeping people healthy and out of hospital like we heard Preetha Reddy say?
So, COVID has actually introduced a very good behavior in the public. Today, public are seeking healthcare, and this healthcare awareness has actually induced people to go towards insurance. I also understand that the PMJY scheme is also being run by the government so well, but they should get in universal coverage, because today there are coverage and exclusions and inclusions in that scheme. I think the government should at least cover the senior citizens above 60 whose incomes are going down as they age. And with increased healthcare and better healthcare, the life expectancy has also gone up in this country. So I believe because of this new health-seeking behavior and an increase in lifestyle disorders, the government should create a corpus only for creating awareness about this, and especially oncology. Oncology is going up like an epidemic. It has not realized, but in every hospital you find that oncology and cancer patients across are increasing, and that's something which I feel the government should now focus a lot. And also maybe focus a lot on giving incentives to healthcare or private healthcare organizations to get in medical equipments into the country. And maybe with the Make in India scheme, the government of India can actually ensure that big companies which get in imaging technology should be manufactured in India. This will bring down the costs. And if the costs are down, actually we can pass it on to the public as well as ensure we get in universal healthcare across.
Yes, indeed. In fact, we heard Preetha Reddy talk about this as well, that the input costs are pretty high right now. Most of the equipment that is being used, medical equipment, is all imported. And unless that really comes down, unless we have the Atmanirbhar push in that particular sphere of the healthcare sector, perhaps we may not be able to pass on the benefits to patients going ahead. But Dr. Laharia, what's your sense about research? It's a big part of what the centre should most likely focus on when it comes to healthcare in terms of infrastructure. There is also the question of education, something that Dr. Talaulikar just mentioned. Human resources is another factor. What, in your opinion, should be the list of priorities right now? How would you rank them for the Finance Minister if she was to ask you today?
So, if we want to talk about budget and health, we need to remember that health as a whole need to focus upon three things. One is the health promotion, which essentially means advising people to stay healthy, the methods they adopt to stay healthy. So for health promotion, then second is the early detection or prompt detection of disease, which is possible through the primary healthcare system. And then people who fall sick, prompt management. So health is all about staying healthy, early detection of disease, and providing treatment. What we are talking about mainly the insurance approach that focuses upon people who are fallen sick and who require hospitalization, but that is only a small proportion of people who need hospitalization. Majority of population need outpatient services. And now India, which has a high burden of diabetes, 1 in every 10 adult is diabetic, 1 in every 5 adult is hypertensive. And many of those are not even aware about those conditions because they do not have access to good quality outpatient facility, the consultation services. So what India needs, three things. One, it needs to promote healthy lifestyle in the people, which should be encouraged by urban planning, etc. But that is beyond health sector, but more focus upon majority of people who need outpatient care. So we need to strengthen primary healthcare services, the smaller facilities, and that require both in public sector and private sector. And that is where deficiency is. It is because primary healthcare facilities are not available, consultation services are not available easily. That's when people delay their care seeking and they become sick and they require hospitalization. So if we do a stronger primary healthcare system, we can reduce the need for specialized or hospitalized services. So India need to invest in primary healthcare facility, India need to invest in insurance scheme or tertiary care facility. So that's where you also talked about research. Of course, there is a requirement of a good quality research to understand what are the common diseases. And these diseases vary from one part of country to other part of the country. We also need to understand the health seeking behavior of the people, that if people are not seeking health services, why they delay health seeking, why they go to particular facility. So there is a lot, much need to be done. Final point I want to bring in, that Indian government has already recognized this issue. India National Health Policy 2017 says that government would invest in health to the tune of 2.5% of GDP of the country, but it has remained around 1.5% of GDP. So even by the government's commitment, there is a scope for increasing investment, and there cannot be better time than post-COVID period, the time where we have recognized the importance of good healthcare services, importance of early health seeking, and this is the time government should invest in health. This is the time private sector should invest in health. And I finally would also say, yes, some of the elderly people were talking about the missing middle. While there is
I'll come to the senior citizens and their problems in a moment, Doctor. But on the point about the National Health Policy of 2017, the target was set of 2.5% of the GDP. But really, like you pointed out very correctly, Dr. Laheria, it has remained below the 1.5% mark. So if you're going to bank on a demographic dividend for economic growth, then it becomes imperative that that part of our budget that is dedicated to the health sector rises substantially. There are reasons perhaps why we are holding back, but perhaps some of the answers, Dr. Talaulikar, lies in technology, in adapting technology in every sphere of our lives. That's happening, but also in healthcare and medical help. Is there sufficient scope for businesses right now to start up in that particular ecosystem? The government needs to give it a bigger push, one would imagine. Do you see that coming as well?
Yeah, so as I just mentioned, the government of India's Atmanirbhar scheme to make in India, we should encourage startups to promote good health, wellness, as well as get in technology. And as the other speaker mentioned about research is an important tool to reduce, because if research happens in India, the cost will go down. If we are dependent on research which is happening abroad, it will come at a cost. And the government of India is actually today giving a lot of incentives for startups. But I think healthcare startups are something which the government will have to hold by its hand and give them incentives. Apart from just financial incentives, they need to also support them by giving them outlays to see to it that they bring in new technology, as well as encourage the Indian scientists in this.
So on all counts. But, Dr. Laheria, costs are rising everywhere, and you hinted towards this. Hospitalization today can set you back by lakhs, and this could happen in a flash. For the cause of deeper penetration of health insurance among the masses, what more do you think the government can do, apart from the schemes that are already there? The Pradhan Mantri Ayushman Bharat Health Infrastructure Mission. There is also the Pradhan Mantri Jan Arogya Yojana. Besides the schemes that already exist, perhaps you can tell us what else it's going to take to really rationalize the costs of hospitalization today.
So the best health insurance is the stronger government health system. If government invests in healthcare services, both in primary care and hospital services, it will be the best assurance for the people to get health services. But that is not going to happen immediately. So in that case, the health insurance which are available in the market and also Ayushman Bharat program need to be expanded. Currently, the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana is for bottom 50% of the population, which meets certain criteria. And there are top 10% of population which is covered by different form of insurance, the formal sector insurance. So there is a between 50 to 90% of missing middle, which has no provision of such kind of subsidized health insurance. I think it is the time that Indian government should consider expanding the PMJY scheme to this middle, where the people pay a certain amount of premium and can subscribe to the same benefit as which poor will get without premium. So subscription-based PMJY should be considered for an additional population in the country, and slowly it should move to the 100% of population should be eligible on the graded premium to access or avail or utilize PMJY scheme in the country. That is the only way. But we also need to remember, insurance is not the solution itself, because insurance is only for hospitalized services. I want to reiterate, in addition to insurance, because none of the insurance is available in private sector in India cover outpatient coverage, or they provide small coverage. So we need to strengthen primary healthcare facility, outpatient consultation, both in government and private sector. Then only people will be healthy.
Yes, indeed. There's no taking away from that, because insurance, like you pointed out, covers us for hospitalization, and perhaps the insurance sector also needs to kind of expand its scope, and it is very gradually doing that. But Dr. Talaudekar, don't you think the Indian healthcare system, it largely depends on private hospital networks like yours? Doesn't that need to change? I mean, we're talking about these yojanas and the plans that the government has. I mean, when it comes to non-metro cities, we see this glaring shortage of beds in treatment. We saw it during the peak of the pandemic. Shouldn't people anywhere in the country be able to access good healthcare, sound healthcare, reliable healthcare when they need it, timely? What will it take, according to you?
So corporate healthcare today is one of the major drivers apart from the public healthcare sector, but the tertiary level of care usually happens more of in the corporate sector. But I also agree that the government, if they start giving incentives, which is presently there, the corporate healthcare bodies are very keen to enter into tier 2, tier 3 cities. And some of the hospital groups have already started entering there. So the healthcare will be taken directly accessible, made directly accessible to the public in tier 2 and tier 3. I think what we need to do is give incentives and create infrastructure there in those tier 2, tier 3 to make the highly talented doctors and skilled professionals to also think of shifting down in tier 2, tier 3. Because what we find in corporate healthcare is that you may build an infrastructure, you may build everything, but if the talent is not keen to move because of unavailability of infrastructure, that's something which the government can help. Government can help in building good educational schools there and other things which will help talented doctors, skilled professionals to even settle down in those cities, which will help the corporate healthcare sector to take the doctors there and actually make it accessible to every citizen of the society.
Do you agree with that point of view? You need more incentives to help the cause of a more healthy Bharat, so to speak, in terms of being a doctor, and what you seek in trying to get out of the corporate healthcare system and trying to help the larger India out there. What really holds you back? Dr. Laharia.
We need to remember that India's healthcare system is a mixed healthcare system, where private sector and public sector both providing healthcare services. There is definitely far more need for health services in the country than available by combined private and public sector. So both the sector need to grow together. It is a government healthcare system. If it grows, then the poor will have access to good quality healthcare services. If the private sector grows, then it will provide benefit to all those who can afford or who are covered by health insurance. But definitely there is a far more need for a stronger healthcare system in the country. So people do not have to delay. People are assured of good quality healthcare services. So this requires investment by the government, investment by the private sector, and developing those mechanisms that while we are trying to expand healthcare services do not become unaffordable for the citizens. So keeping the cost within the range is also a responsibility of the government and citizen, and we need to have those kind of mechanisms. But the key point is that India, when we are commemorating 75 years of independence, India need to show leadership to the rest of the world in showing that with the low cost and with the high quality human resources, we can achieve good health for our citizens. And our focus cannot be simply saying that we can provide high quality medical tourism at low cost. It's equally important that we provide high quality services for the citizen of this country. And India definitely can do it. All that is needed, some more nudge and fulfilling those commitments which have been made in the last few years.
Low cost, high quality. We like the sound of that for the healthcare sector, and it's all within reach, as it were, because we are so suitably poised. And it seems like the drivers of the medical system, doctors like you, are willing to give it all that we can to kind of expand the scope of our healthcare services to make them better and, of course, that much more affordable. And the insurance sector will have its role to play as well. We'll see what comes out of the budget, but both of you, doctors, thank you very much for joining us with your perspective on this edition of India Tonight.